My name is Joseph Smullen. I am a licensed clinical social worker here at Believe Behavioral Health, and I practice as a psychotherapist. And today I want to talk to you about social anxiety disorder. We will abbreviate social anxiety disorder as SAD, as you can see on my screen that I'm recording. And so SAD is a widely distributed condition across the general population. It has a lifetime prevalence rate of 13%. So this means that 13% of living adults will have experienced SAD sometime in their life. Now, of note, this doesn't include subthreshold symptoms that also interfere with a person's functioning. And this means that the symptom presentation that somebody might have, the social anxiety that somebody might have, may not qualify for the diagnosis of SAD based on the current diagnostic criteria. Nonetheless, the symptoms are often interfere with their social, relational, occupational functioning. So what is SAD? So the signature of SAD is a disabling fear or anxiety of being criticized, outed, and rejected by others in social situations. So those that SAD fear embarrassment, they fear being discovered as being anxious, and they enact behaviors and thoughts and emotional reactions that we're going to talk about that are all interconnected and interrelated that serve to fuel and strengthen SAD itself. So how does someone develop SAD? Approximately 30 to 60% of cases of SAD are genetically transmitted. So this means you may inherit from either paternally or maternally the propensity to develop the disorder. However, there's other factors going on here. So you'll notice a mix of nature and nurture. So other factors would include things such as behavioral inhibition to the unfamiliar, which involves the limbic system reactivity. We'll get into that in just here in a minute. It may also involve circumstances in life that combine social situations with a humiliating or rejecting experience. It usually also involves unhelpful cognitive evaluations or appraisals of what's going on inside and what's going on outside. And lastly, another common factor in the development of SAD is an insecure attachment profile. So the combination of nature and nurture is important here. There's no one single pathway to developing SAD. So we don't take a one-size-fits-all approach, and we want to treat the person first. So we're going to talk about 3 domains, namely the limbic system, which involves the emotions and felt sense of reactivity. We're going to talk about thinking and how that's involved in the development of SAD. And we're also going to talk about the behaviors and actions people take that also furthers the development and strengthens the ongoing existence of SAD in someone's life. Okay, so first I want to bring you down to this sad emoji over here. And the sad emoji, it's really important here that, to understand SAD is to understand that the emotions in SAD are predictably in excess, and those emotions is namely anxiety and fear. There's a felt sense of danger. So, essentially we can look at our limbic brain as a threat detection system. It's very crude, and it either determines you're safe or not safe based on real or imagined threats. When it's activated, the sympathetic nervous system becomes aroused, and the stress response is unleashed, and we feel that physically, we feel that emotionally, while at the same time there is things going on neurochemically, hormonally in our bodies. So what I had discussed for a moment earlier, I had mentioned that behavioral inhibition to the unfamiliar is important here. And behavioral inhibition to the unfamiliar refers to an innate temperamental feature. That means it's inborn, we're born with it. And it's associated with this reactive limbic system. So people born with a reactive temperament often have this elevated BI, or behavioral inhibition. And having a reactive temperament or elevated BI is associated with a reactive limbic system. It's associated with having a autonomic nervous system that becomes aroused and is very sensitive, becomes aroused easily and is very sensitive. All of these combine into the development of SAD. Now, notice, like I had discussed before, it's not simply one pathway. It's not simply a singular explanation of SAD. Anytime you have someone claiming that there's a singular explanation of something like social anxiety disorder or depression, they're typically unfamiliar with how these disorders develop, and we can pretty much say with confidence that they're misinformed. So again, one domain involved in SAD is an excess of anxiety. Okay, so how is this related to behaviors? So let's jump on over to our mustachio and eyeglass wearing emoji here. Okay, so the behaviors in SAD predictably involve avoidance strategies, and these we call safety behaviors. So safety behaviors um, are 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 created and developed and used as strategies, survival strategies, if you will, and they all kind of help someone avoid the anxiety of social situations. And in some form or another, they involve avoidance, and they also involve reducing the potential of one's anxiety to be detected. So really anything could be classified as a safety behavior regarding SAD when we start evaluating, what someone is doing to avoid and perpetuate SAD. And these things are, so the examples I put on the sheet that you'll see, it says it can include things like distracting yourself, avoiding eye contact, wearing extra makeup to avoid blushing. People that are socially anxious tend to get a physiological reaction, as we discussed earlier. So sometimes a physiological reaction or an excess of emotions is shown on someone's face when they're blushing. So an avoidance strategy or a safety behavioral strategy that someone might do is they might predict, hey, I'm gonna usually end up blushing in social situations. So what am I gonna do? I'm gonna load up on the makeup. Okay, but other ones are just as common, and these are things like finding excuses not to leave home or bringing a friend. For example, I feel uncomfortable working out in the gym because I'm thinking, we're going to get into that part, I'm thinking people will stare at me and they're going to be evaluating me negatively. At the same time, someone's reactive brain, their limbic brain, is sending norepinephrine and cortisol is being coursing through someone's bloodstream, and at the same time we're doing things to avoid the anxiety, which only furthers the likelihood of emotional reactions and unhelpful thinking. Well, so these behaviors, these safety behaviors, are 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 pretty difficult to break, but treatment is really focused on a part of treatment, at least the behavioral aspect. I'm going to bounce back to the the coping that we might use to reduce the emotional reactivity here in a second, but coping for the safety behaviors is really focused on exposure therapy. So exposure therapy is simply exactly what it means, except instead of exposures happening in unpredictable situations or happening when um, you know we least expect them or trying to avoid them, the therapeutic exposures are different. They're intentional. We mean to do them, and they're prolonged and frequent. So we set up homework assignments to send someone on a mission to access a store 2 times in the next week, stay for at least 15 minutes, and say hi to 2 people. That's just an example. And that's and while at the same time resisting the urge with other coping skills to enact the safety behaviors, such as avoiding eye contact or wearing a hat down where your brow is so low so you won't have to look at somebody. And the last thing I really want to say about social behaviors is that they really uphold they really uphold an internalized implicit rule that I must not let others know that I'm anxious for me to be okay. And they help preserve the status quo of the belief that I am socially incompetent, I'm awkward, I cannot be around people. Because here I am, and this is the only way I can handle going to HEB. The only way I can handle going to HEB is going at the very late hours when there's no one there. I wear my hat down low. I don't look at anybody. I make my list, put it on the front of my cart, grip the cart with white knuckles, and I just get through the store as quickly as I can. Okay. So the final part in this interconnected dynamic between our behaviors, our emotional reactivity, and our thinking is just that, our thinking. So thinking in SAD is predictably narrow and unhelpful. People form faulty cognitions, and they are instrumental in the development and sustaining SAD. So this comes out of cognitive theory that SAD is created and maintained by irrational fears of being censored in public. People with SAD magnify the possibility of imagined punishment, so they overestimate danger of situations, they magnify the problems while simultaneously minimizing their ability to cope with it. So another aspect of thinking in SAD involves, I just had a pop up here, let me get this out of the way, sorry about that. So another feature of SAD, of the thinking aspect, the cognitive appraisal and evaluation aspect of SAD, is that there's a hyper focus on internal states. So while at the same time when our emoji face is real reactive over here, someone with SAD typically is very aware of their physiological arousal, and they combine this with these negative self-evaluations, essentially creating a barrier to any new input, to any new possibilities, that what they're feeling, what they're thinking, and what they're avoiding could be just a false alarm of danger. As we talked about earlier, um, the emotional reactivity in someone's limbic brain, the limbic brain is crude. So it's on or off, safe or not safe. And it can be triggered by real or imagined events, either internally or externally. So this is an internal trigger at times when someone is thinking about the situation. They're overestimating the danger. They're magnifying the issue that's going to happen. They're jumping to conclusions. I know people will be looking at me. I know they're talking about me, and I cannot handle this. So while their emotions are in excess and they're they're dysregulated. There's a hyper focus on these internal states, basically saying, see, I am anxious. I need to get out of here, or I need to not come here again. Okay, and another aspect of the cognitive domain is post-event processing. So people with social anxiety disorders are riddled with negative autobiographical memories of the event. So what does this mean? This means they go home and dwell and ruminate on what happened. I know that person was talking about me. Why were they looking at me that way? Why did I handle the situation like that? Why did I say that to so and so? I shouldn't have said that. This is the internal messaging system of someone with SAD. So coping with the cognitive aspect, again, it's interrelated to the behavioral aspect and the emotional aspect. The behavioral aspect, we're exposing ourselves and resisting engaging in safety behaviors, while at the same time we're focused on shifting our unhelpful ideas and forming new perspectives. We want to see things from a different lens, and doing so allows us to avoid the avoidance strategies. It allows us to resist the safety behaviors. And finally, I just want to shift back to the where coping is focused on our excess emotions, and this involves at some point soothing and down-regulating the nervous system or the stress response, and this may be things like deep breathing, progressive muscle relaxation, or meditation, or in the opposite, it's getting physical with it. Exercise is a beautiful way to help deal with anxiety. So this is the overview of social anxiety disorder. I appreciate you listening to this this video blog, this vlog. I also have this in written format, and my name is Joseph. I'm a therapist here at Believe Behavioral Health. We offer psychotherapy for children, adolescents, and adults, and we also offer case management and targeted case management and rehabilitative skills training, all of which are helpful in treating, caring for, and neutralizing social anxiety disorder. Thanks for your time, and if you need some help, I encourage you, or if you or someone you love would like to get some help or just get a different perspective on what you're experiencing, please give us a call today. Thanks.